So it's going to go through your olfactory into your limbic system, and those neurons and chemical components are going to talk to each other, and they're going to say, hey, let's calm down. Hey, let's uplift. And it's going to create that physiological response using the pure essential oils.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this week's episode of the First Case podcast, we are wrapping up season 11 with Melissa Vibberts and Laurel Flanagan. Melissa is the director of brand management for Elequil Aromatabs, and Laurel is the clinical product specialist and a certified aromatherapist. And we are going to be learning all about clinical aromatherapy today. Chris, what are your thoughts when you think about aromatherapy in the clinical space?
So I actually use aromatherapy all the time. I have lavender going right now. So to learn more about not just the fact that I enjoy having it, but the physiological reactions that can occur, I'm just stoked to learn right along with you today.
Yeah, I'm excited to learn that it's not just something we smell, but it actually has a physiological effect. Is so cool, and I'm excited to dive into this. So don't go anywhere. We will be right back with Melissa Vibberts and Laurel Flanagan.
Hi, I'm Chris Blevins.
And I'm Melanie Perry.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Melissa Vibberts, Director of Brand Management for Elequil Aromatabs, and also Laurel Flanagan, Clinical Product Specialist and Certified Aromatherapist. Ladies, you have the honor of being guests for the finale of Season 11. I am so glad that you have joined us today. Thank you for being here.
We are very excited to be here. Thank you.
Thank you so much for having us.
Absolutely. You know, I was first introduced to clinical aromatherapy at an AOR event a few years ago. And, you know, at first, I have to admit, I was a little skeptical because it wasn't something I was very familiar with. However, personal experience and then education and seeing just how much research is out there really helped me understand how beneficial it can be. So I'm super excited that we can share that knowledge with our audience today. But before we get started with our conversation today, why don't you both introduce yourselves and tell our audience a little bit about who you are? Melissa, why don't you go first?
Great. Melanie, I'm so happy to be here. I wanted to say that again. And I have been with Beekley for 17 years.
Wow.
Beekley Medical primarily is a medical device company with products really focused in radiology. But this unique brand with Elequil Aromatabs has really had me focus in this area for quite a few years now.
Awesome. And Laurel, tell us about you. I'm excited to talk to a certified aromatherapist. How exciting.
Hi, yes, I'm Laurel Flanagan. I started back in 2019. I graduated with my MBA and jumped right into the world of sales. And as I was going through my early career stages, I really felt a lack and a need for something that was more patient-focused and customer-centric. And so I found my way to Beekley Medical, and I jumped right into the Elequil Aromatabs team. And I've been here for 2 years now and loving it.
Well, that's amazing. And I'm really curious because you guys sound like such a powerhouse team. But how does one become a certified aromatherapist? Am I saying that correctly?
Yes, yes, you are. So There's about 3 levels to a certified aromatherapist. And I am currently a level 1 certified aromatherapist. And it's about 60 hours of coursework and 5 case studies to become one. And then a test to get certified. So yeah.
That's awesome.
That's really cool. So you became a certified aromatherapist because you were looking for something patient focused and something that you were passionate about. And that is connected to the world of essential oils as well, right?
Yes, very much so. So the ideology of aromatherapy is really this comfort and healing measure, and really to create that healing, comforting environment for you, whether you're in the clinical setting or at home. So it's really something mind-body connection to kind of bring people together. Absolutely.
All right. So then, Melissa, knowing this about essential oils and aromatherapy, how does all of this connect with Elequil and with the healthcare setting?
Sure. Well, our company, Beekley Medical, really looks to the healthcare professionals when there's a need, when healthcare workers have a challenge or there's a need in the industry, they often come to us and we listen, and if it falls within our wheelhouse, we will create a product to help the need. Okay. So in 2010, we had an MRI technologist approach us and share that there's really a big problem getting patients through MRI.
Oh,
right?
I can totally
Patients
see,
come
too.
in.
I've had an MRI.
Have you had one?
I've had several. And just the noise alone can make you anxious, but also the you have to stay still. And I get jittery when I'm anxious, so I can only imagine.
I can totally see that.
Yes, right. I'm like a little dog, so I don't know. I'm so impressed that they came to you. How does one even decide that they come to your company and say this is an issue? I'm curious as to how the origin story of the MRI happened.
Well, it was in 2010, so I'm not really remembering exactly how that in fact happened. But what we do as a company, we talk to people at conferences, or we have customers that we talk to often that we know that become our friends in a way because we speak to them so much, and they just happen to share situations with us. And whenever we hear something from a customer, we always submit it to product development. And when we see a trend, then from there, we look into creating a product, which is how Elequil came about. And what the MRI technologist had shared was that oftentimes, like yourself, Chris, you'll go in as a patient and you don't really know what to expect. So right there, you're nervous, you're anxious, and also you're there for a reason, right? There's a reason you're getting an MRI. They're trying to find something. But a patient can go in, you mentioned the sound, and the bore is very small sometimes, and you have to be still. You're in there for a while, and patients become anxious and claustrophobic. And many times a patient needs to be pulled out. The scan is aborted, which is not ideal for the patient. They're not getting their diagnosis. And it's not ideal for the hospital because they're losing a time slot and money, right? So from that whole challenge, we got together and we created aromatherapy for the clinical setting. And it's, our product in particular, it adheres to your gown or clothing. So it can go in to the MRI unit with you, and there's no metal, so that's not a problem. And that's where it all started. And then interestingly enough, other departments in the hospital kind of noticed there was a little buzz about the product, and they started saying, hey, hold it. We have anxious patients. Why can't we get this? And it really has grown organically over the years from department to department. And we actually have entire healthcare systems that utilize our product.
I really love the whole word of mouth thing, because as healthcare professionals, we are really good about running our mouths when we like something, and we will tell all of our friends, which is a good thing when it comes to learning about something that can be very helpful for the clinician or for the patient. But I really want to dive into the specifics about the essential oils that we're talking about. And Laurel, I think this is your area of expertise, but what are the oils that we're talking about? And can you tell us a little bit about how they work?
Yes. So we really focus in the clinical setting on 4 different essential oils. And basically what an essential oil is it's a concentrated organic compound derived from plants, trees, roots, herbs, sometimes the rinds of the citrus plant, to really extract them through a process of steam distillation to create those oils. So then we take those and we use them in the clinical setting. And what the oils that we're using, such as lavender, peppermint, sandalwood, orange, and ginger, they're going to trigger specific compounds in our brain and help us calm, relax, uplift, soothe queasiness, so on and so forth.
So I have a question in that because, what makes the oil an essential? And, I think to add on to that, there are so many taglines, right? Organic and cage free and all of these, the nomenclature we use to define things that, make us think that it's healthier. How does that work with these oils and the different grades? Am I saying that correctly?
Yes, absolutely. So a lot of times we'll go into a store and we'll see something that says it's aromatherapy. We'll see essential oils, and a lot of times they're not. They have synthetics or pesticides, they have carrier oils, they're diluted or they're adulterated to be able to be put on the shelf at a price point and an attractive thing to a consumer. But when we talk about it in the clinical setting, we want completely 100% pure, unadulterated, non-diluted, non-mixed essential oils to really get the most clinical benefit.
Right. That's scary. Pesticides? Melanie, my eyebrows are... Right. And now...
Melissa.
And I wanted to add that, when you do go to the mall and you purchase a bottle of oil, you open it, you smell it, and it smells good. And you do have a psychological effect. But when 100% real, pure, high-grade essential oils are used, you also have a physiological effect.
That's interesting.
And that's what our oils do. And Laurel can help explain how that works.
Yes, please do. Laurel, keep talking.
So when we smell something, so a lot of times people will smell a rose or a lavender bush, and there's two different ways it's going to trigger your brain. It can trigger your psychological conscious and give you a happy memory, but it's also, when we use those essential oils, it's also going to create a physiological response. So it's going to go through your olfactory, into your limbic system, and those neurons and chemical components are going to talk to each other, and they're going to say, hey, let's calm down. Hey, let's uplift. And it's going to create that physiological response using the pure essential oils.
Okay, so I got to ask, because you mentioned some specific oils just a minute ago. You said lavender, peppermint, orange, ginger, sandalwood. What specifically do each of those oils do? Because I know they have to do something different because the oils are different.
Yep, absolutely. So when we talk about a lavender, we're talking about something that's going to really help calm and relax. When we talk about a peppermint or a ginger, those are really going to be focusing on soothing queasiness. Our citrus and orange, think happy. It's going to be a little bit more uplifting. And then when we have something like a sandalwood, which is a very hearty base note coming up from the roots to the middle base of the plant, it's going to be really prolonging the life. It's going to be really adding to that lavender component that we mix it with to help prolong the strength of it.
So are there different, you just mentioned like having two separate oils that are blended together. What combinations are you finding are, the best at elevating those physiological responses?
So we at our brand, we have lavender sandalwood, which is one. We have an orange ginger, we have a lavender peppermint, and we have an orange peppermint. And so those ones are really going to help focus on either soothing queasiness and relaxing, or uplifting and soothing queasiness as well.
So I can tell you in the operating room when we have certain surgeries, and Melanie can speak to this too.
Oh yeah.
There are certain surgeries that, they're going to be bodily smells, and they're not the most pleasant,
They do not smell good at all. Peppermint oil, man.
Yes, that's exactly what I was going to say, because we will put peppermint oil on the inside of our mask to be able to, get through that and make sure we're really not focusing on the smell, but focusing on the patient. So I love that this is helping not just in the operating room for us, but for our patients and their pain management as well.
Yeah, absolutely.
Yes. And the most popular aroma blend that's used in the surgical services area is the lavender peppermint. And the reason being is that you can put it on in the patient in pre-op, right, to help relax. The lavender is doing that. They go through OR, they come out and they're in the PACU, and now they may be queasy, right? So the peppermint can take over there. So you can have one product that's start to finish.
That's really cool. And it really takes the patient's experience into account, because in pre-op, I'm probably going to be anxious. And in post-op, I'm much more likely to be feeling queasy from the effects of anesthesia and just going through the procedure. So you hit them with that 1-2 punch, and it really is. It's taking the whole patient into account. And one thing that came out when you and I were talking prior to this interview was actually that there are mandates now that require that non-opioid, non-pharmacological, other modalities be made available to patients. Can you talk about some of those rules?
So yes, so back in 2018, the Joint Commission came out with a statement saying that all facilities had to have a non-pharmacological option to pain and opioid reduction. And that's really the wheelhouse where aromatherapy would fall under.
And it's also beyond the Joint Commission. The CDC has guidelines of offering non-pharma therapies. The U.S. Department of Health and Human Services mentions how there could be complementary and integrative approaches to pain management. NIH has grants for studies for non-pharmacological alternatives. So there's a lot of agencies out there focusing on non-pharma.
And I also was reading in the AORN guidelines, and I noticed in the AORN guideline on complementary care that they also mention clinical aromatherapy as an alternative to helping patients in the surgical experience. So it's cool to see all of these organizations and these mandates coming out that enable patients to take advantage of other modalities other than narcotics to manage their pain, to get through the surgical experience, and then be able to move forward without that risk of an opioid abuse or an opioid addiction, or those things that we are trying so desperately to avoid in our current opioid epidemic. And I'm curious, because we also, through this season, we have talked about ERAS protocols. We have talked about all of the ways that we are paying attention now and ensuring our patients are moving through the surgical process with access to these other modalities. How do essential oils fit into those ERAS protocols?
Yeah, so I can talk about that. So ERAS is the whole ideology. It stands for Enhanced Recovery After Surgery. And it's the whole mentality that we know we're going into surgery. We know there's going to be pain. We know there's going to be a specific level of discomfort after our surgery. What can we do before that to really mitigate those risks and those uncomfortable issues that we're going to be facing? So it can start weeks before a surgery, just preparing the patient mentally, physically for that. But when we talk about aromatherapy, it can start the night before, really using the aromatherapy, using the essential oils to help calm us down, going into our procedure, the morning of, using those essential oils and helping focus to really make sure we're having the least stress possible going into a procedure. So that way we have easier times going under anesthesia, we have an easier time throughout the surgery. And if your body isn't tense from that stress that you had beforehand, then it's going to make just going into your recovery much easier.
That's fascinating. And I am an avid user of essential oils, as you all saw earlier. Lavender and I are really close friends. So learning now that the essential oils can be effective in reducing pain, especially postoperative. You mentioned that the patient could use it the night before, and I would imagine education is a big deal, right? Like, help educate us too. How do using these does using these essential oils the night before help them through the operative procedure?
Yeah, absolutely. So it all depends on, you're right. The whole idea of an ERAS program is to educate before the surgery and really talk those patients through what's about to happen. So it really all is going to go back to, when is your anxiety going to start? When are you going to start to feel the most anxious? So if we can start the night before, because that's probably when you're going to go through and you're going to lay down in bed, you're going to start ruminating over what's happening the next day, you're going to want something to soothe that anxiousness. And so that's really why we can bring it in the night before. And clinical studies have shown that it can start working on patients within 30 minutes of using aromatherapy. But it all just depends. So if you're going to go to bed, if you can't get to sleep, let's bring in those aromatherapy. Let's bring in that essential oils. Let's help you calm and relax, get to sleep. And then when we wake up in the morning, let's reuse it. Let's do that again. Let's create those consistent results to help calm us down before we go into our procedure.
That is really true, because there is no substitute for a good night's sleep in a well-rested patient going into a surgical procedure.
I know for me, I've had surgeries in the past, and I remember just laying awake in bed at night being like,
exactly.
I kind of also want to eat now because they told me I can't eat. Like, something please help me to sleep.
It's all of these.
Help me relax. Yeah.
Yeah. And
I lay there in panic.
Exactly. And we as healthcare professionals too, I mean, we know too much. And so we are, every time I've had surgery, my head spins, and I wish I had known the benefits. Hindsight's 20/20. Yeah. So learning all of this and understanding how much education goes into using this aromatherapy and essential oils, this is kind of new for me. I wonder, are there any clinical studies out there that have been done recently that are helping to kind of back up and help our patients understand why this really is going to benefit them?
Absolutely. What's really exciting, there are many hospitals who are conducting quality improvement projects or even having, investing in clinical studies to better determine how aromatherapy can help patients. And there is evidence out there. I Google quite often aromatherapy clinical studies, and you will see a plethora come up. But the most recent one that we are very excited about has to do with pain. And it came out in September of 2023 in the Journal of Pain and Relief. And it was a study conducted by the University Medical Center of Pittsburgh, UPMC. And they used lavender peppermint prior, again, kind of like with that ERAS type of approach, prior to surgery to help relax the patient, and then offering it again afterwards. And their results were that it had a 26% decrease in pain, 33% decrease in opioid consumption, which is very exciting.
No way! That is amazing.
It also, that study also had a 48% reduction in acetaminophen consumption and a 78% decrease in post-op nausea vomiting.
All those things.
So for all of these things that we're flooding our systems with to have to take medication for, and, putting our system, to process these drugs, and instead we're able to have an aromatherapy that has the same physiological effect without administration of medicine or as much administration of medication. That is incredible that research is there.
It's so nice to have the research because, like you said, you have a diffuser in your office. People are using aromatherapy in their everyday lives, so we can bring that safely into the clinical setting. It's really a home run.
Yeah. And I think too, like people like me who are sometimes maybe somewhat skeptical, and they're like, there's no way that just breathing something or inhaling it or exposing myself to this aroma could possibly be as effective as medication, because the pills work, and and so to change their mind and to say, yes, there is research that proves this. You've got a research study that was double blind, had a placebo in it. It's peer reviewed. People can look to this research and say, okay, I can trust that. That is legitimate research. And this is something worth trying because, once again, we want to find alternative ways to manage our pain, to manage that nausea and vomiting without having to take a narcotic. And it's incredible that research is out there and shows that it works.
So Melanie and I always say how quickly time flies when we're having these interesting conversations and episodes. And, we've learned so much. And I think, I don't know, Melanie, the key to me has been just education. And we really appreciate, what you all have done. And thank you for coming and talking to us today.
Well, we want to thank you, first of all, for having us as a guest, but we also want to commend both you, Chris and Melanie, on your First Case podcast for having a season that focuses on non-pharmacological solutions. So thank you for that focus.
It has been an incredible learning experience for Chris and myself this whole season. and to find all of the different modalities out there and the different ways that people are committed and are working to educate the public and working to improve the way that we treat patients has been just mind-blowing this season. So thank you so much for being here today, for sharing your expertise and your passion with us. And thank you for being our final guest on season 11. So thank you so much for being here.
Thank you.
Thank you so much for having us.
That was Melissa Vibberts, Director of Brand Management for Elequil Aromatabs, and Laurel Flanagan, Clinical Product Specialist and Certified Aromatherapist. And as a former skeptic, I can honestly say that I am amazed at how proven and effective essential oils can be for helping patients who are anxious, who are queasy, and even proven in studies that it can also help with postoperative pain and reduce the amount of medications that our patients are taking. I'm thankful that we have the modalities available to us, like clinical aromatherapy, and that they are now being made available to patients. But Chris, you know what else I am amazed at? I am amazed that we are finished with season 11. And I'm blown away that it went by so quickly. What was your biggest takeaway from this season?
I'm so glad that you asked that. And also I'm so grateful that I was with you for another season. You're amazing. And this podcast has been so educational and fun. But I think the biggest thing that I took away specific to the opioid epidemic is that, Hollywood, and we've seen these documentaries and these movies and TV shows and things that have come out. And I think that they portray the medical side of it in a very poor light. And what we have learned this season is that there are so many amazing experts in the field of healthcare that are working their tails off to stop the misuse of opioids and to treat the whole patient, as we learned today. And I am so grateful to learn about that. And maybe we have just a little part in allowing the general public to learn about all of the effort that's being made to decrease opioid use and hopefully, slow down what's been so devastating to families and patients all over the world.
Yeah, absolutely. I think each of our guests have been working hard to change the course of the current epidemic. And sure, they are doing it in their own unique way, but they are fully committed to a non-opioid approach to surgical care. And that is so cool. And we discussed many non-pharmacological modalities for managing postoperative pain, and every one of them is backed up by research. This isn't just some MLM scheme where you're like being asked to drink the Kool-Aid and buy into it. Like, it's legit.
I just like how it smells.
I just like this, but it's real and it works, and research proves that. And I think that's the value in it. We know that it's backed up by research. It's not just some idea, and it's fun. It has been fun to dive into those modalities this season, but that is going to do it for this episode and for season 11. On behalf of Chris, myself, and the whole team here at First Case, thank you so much for joining us for this season, and thanks for listening to this week's podcast.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.